One of the first areas to receive facial treatment in the fight against aging is the eye. Dr. Bruce Landon is back with how he can help restore this area along with a special offer. Dr. Landon, welcome back.
Thank you so much for having me.
We are glad you're here. Stay tuned for that special offer. But first, we got to talk about the eyes, because I feel like so often when you're looking in the mirror and aging starts taking place, you do some of these things and kind of wonder, what are we talking about here exactly?
So really, keep in mind, remember, Natalie, that this is the first area that people engage. When you meet somebody for the first time, we don't really look at the neck, we don't look at the jawline, even though it might be secondary areas of aging, but this is the area that we engage with. And so a lot of times it's the first foray into at least checking out some options for surgical management for most people. They just feel like there's a little bit more hooding, there's a little bit, my eyes aren't as open as they used to be. And so, you know, we find it's a very natural kind of a first checkout of what we can help them with.
Well, let's talk about hooding. I'm assuming you mean the eyelids, but again, I'm new to this area, so kind of break down exactly what areas we're talking about.
Right, so especially in the upper lid, you know, a lot of attention is focused on just what might look like it's the upper lid itself, and so people immediately gravitate to kind of this area right here. What we do in our specialty is we've got to look at the whole picture. Most of what's happening in the upper eyelid is actually related to the forehead aging, so you can't divorce yourself of what's going on with the brow when you're looking at the upper lid. We see a lot of times people are getting it done under insurance. They're failing visual field tests in the optometrist's office. Those don't really take into account the relationship between the eye and the brow. So they're getting these eyelids done, they're getting done very aggressively, and then people want to know why they look a little bit different, why my eyes aren't quite as open as I expected them to be. It's because they've been a huge neglect of that area that needs to be looked at in concert with the upper eyelid, and that's the brow. It's this part of the brow that really starts that aging process, and it affects hugely what the upper eye looks like to you and I.
So I just kind of trying to understand what you're saying. So basically, if you have the eyelid fixed, people think that they're going to get these great results, and then it's like, wait a second, the results weren't there that I was hoping for, because you're not actually treating the problem.
Right,
correct?
It really falls below their expectations for outcome. I always tell everybody, Natalie, go home, put your index and your thumb on the brow and move it up and down, and you'll see just what impact it has on opening and closing the upper eyelid. And that's in fact what we're trying to help them recreate with surgical management, because we now have a real host of great, more minimalist procedures to help them move that brow, so people don't have to worry about, I've got this, I don't want to have the startled deer in the headlight look. I don't want to look like my brows are in the middle of my forehead. I mean, that doesn't have to be done today. That's just not a feature of how we can do things.
So we were talking about the upper eye, but I know some people, I'm sure, at home, and I'm definitely known for like bags under my eyes when I'm tired. What can we do about that, since we're kind of talking about the eye area in general today? Again,
there's a host of different ways that we can attack it, because the three principal features of aging of the lower lid are a little bit of skin excess is some of the first signs that we typically see. So the bagging that we start to see is a loss of the integrity of the tissues that hold the fat around the eye. And then we typically kind of see this troughing, or these cheek tear trough hollows, we call them. And so those three elements are really what we're trying to help people correct. And we do it by tightening up the skin, modifying those fat compartments, and then helping address some of that hollowed area. Again, it's looking at all three tiers of aging of the lower lid.
In closing, I want to get your thoughts. If someone's watching at home, and maybe you're sitting at home doing one of these numbers too, who makes the ideal candidate for procedures when it deals with the eye? When do they know it's the time to pick up the phone and call you?
You know, there's so many facets that are responsible for aging of the eye. We get people at the one end of the spectrum, Natalie, that can be, you know, in their teens, believe it or not, but this is genetic predisposition. This is, my mom had it, my grandma had it, my father has it, and it's premature aging around the eyes. So they're not unreasonable candidates for surgery just by virtue of their family genetics. I would say that the bulk of people, because we start to really see the main changes around the eye in our late 40s and then advancing forward. So that's probably the more common age group, from late 40s on into 7th decade.
Well, and now is the time to call, because I kind of teased at the beginning about a special offer. And right now, viewers will get a consultation with Dr. Landon and $1,000 off the eyelid procedure. There's the information on your screen to receive this special pricing. And as always, Dr. Landon, thank you for coming in today.
Thank you very much, Natalie.